presentation will be on the effects of stressors on the heart. We will discuss how cardiovascular issues affect the rest of the body, how stressors can impact the function of the heart, and we will provide 3 examples of stressors that affect the heart. Difficulties with the cardiovascular system can lead to greater fatigue, weakness, chest pain, and shortness of breath. When experiencing issues with the heart, many people must adjust to a slower pace of life to conserve energy. Factors that cause stress for the heart can lead an individual to experience an increased risk of heart disease, higher blood pressure, and higher cholesterol. The next few slides will provide 3 different examples of how various stressors may affect the cardiovascular system. The first article is titled, Effect of Excessive Infant Crying on Resting Blood Pressure, Heart Rate Volume, and Cardiac Autonomic Control in Childhood. The researchers in this article state the claim that the bodies of developing infants are easily susceptible to various influences, especially stress. The stress is portrayed in the only way infants can communicate, crying. The researchers took interest in this to see if an excessive amount of crying can have any adverse effects later in childhood. Another important factor in this study is the concept of homeostasis. This refers to the body's ability to regulate systems within it. With a goal to view how stress in the earliest months of life may affect the cardiovascular system later on, researchers hypothesized that excessive crying would influence the homeostasis of the autonomic nervous system later in childhood. Researchers claimed that a high amount of stress in early months would offset the set point in a child's homeostasis. To conduct this research, mothers of infants aged 11 to 16 weeks were given questionnaires inquiring about the amount the infant cries, the maternal burden that infant care brings, and any aggressive behavior that the child may witness on a daily basis. The heart rate, blood pressure, and heart rate volume were measured while the infant was at rest. 5 years later, the children returned and had their resting heart rate, blood pressure, and heart rate volume measured again. The results showed that 2.8% of infants displayed excessive crying, but this was not reflected in the measurements taken while the children were 5 years old. There may have been many other factors that contributed to the measurements taken at 5 years old, making the results difficult to draw conclusions from. The mothers also may not have been truthful in the initial questionnaire because it asked about the burden that care brought and any aggression that the child may have seen on a daily basis. Not many studies have been conducted on this topic, making it difficult to compare and analyze.
In this study, the researchers are questioning how post-traumatic stress symptoms begin and continuously occur in pediatric heart transplant recipients, because it is unknown to how these symptoms occur so often. The researchers want to figure out how these symptoms occur and hypothesized that the illness that occurs before the transplant is a major contributor to these post-traumatic stress symptoms. The initial predictions made by the researchers were that the pre-transplant illness contributes mostly to the symptoms that the patients have after the surgery. They also quoted data stating that 30% of adolescents displayed stress symptoms after their organ transplant, symptoms ranging from PTSS to PTSD. The experiment was conducted by looking over hospital records, operative notes, outpatient notes of the patients who had pediatric heart transplant surgery between January of 2004 and February of 2007, as well as their follow-up notes. Their medical history was taken into consideration to view both their diagnosis and the post-traumatic stress symptoms if they had been reported by the patient. The data collected was from clinic visits from up to 1 year after the transplant, as well as 3 to 5 years after the transplant, to determine the long-term outcome. The post-traumatic stress symptoms reported were compared against the DSM-4 diagnostic criteria for post-traumatic stress disorder. This diagnostic criteria included, but was not limited to, anxiety, nightmares, irritability, insomnia, detachment, regression, and poor adjustment. If the patients reported at least one of these symptoms listed, they were considered having post-traumatic stress symptoms. The frequency of the consideration of post-traumatic stress symptoms was a categorical variable and was further analyzed using the Pearson chi-squared test. The results were incredibly significant. Basing the symptoms on the DSM-4, no patients were considered to have PTSD because of not meeting the diagnostic criteria. However, considering they reported having at least one of the symptoms of stress listed, they were charted as having PTSS. 34% of the patients had one or more post-traumatic stress symptom. It was found that 22% of pediatric patients showed to have depressive symptoms. 55% of pediatric patients had PTSS when they were evaluated after their prior transplant. However, 45% reported having no post-traumatic stress symptom. The research hypothesis was not supported heavily throughout this investigation. The initial prediction was that the pediatric heart transplant patients experienced these symptoms of stress because of their initial illness. However, data found that the difference between the symptoms experienced by patients before their second transplant was not a significant difference compared to the patients who were about to undergo their first transplant. This shows that the disease was not the most significant stressor to prompt post-traumatic stress symptoms. The key implications of the results found from this study show that the psychological and mental well-being of the pediatric patients who have heart transplantation surgery is severely impacted by this surgery. The frequency of how many transplantation patients have post-traumatic stress symptoms show that the surgery has long-term effects on the mental health of the patient and therefore should be further researched to be able to help with the patients so that they no longer have to experience these symptoms post-transplant.
Another stressor that impacts the heart functions and cerebral blood flow and oxygenation is exercise, especially in COPD patients. Here in this experiment, they hypothesized that the pathophysiological consequences of heart failure on cerebral hemodynamics can replace effects of COPD on exercise, cerebral blood flow. They took 18 males with moderate to severe COPD that underwent a 4-stage cycle arogometer test with prefrontal cerebral blood flow and oxygenation measurements. Some controls that they kept constant were that the patients were seen by the same respirologist and cardiologist and were under the same triple therapy for COPD. The overlap patients and COPD patients were receiving selective beta blockers, ACE inhibitors, diuretics, which increase the impairments in cerebral blood flow during exercise. The concluding statement in this experiment was that the impairments in resting cerebral blood flow are worsened by the stressors of exercise in COPD patients presenting heart failure as comorbidity, and cerebral hemodynamics and oxygenation may become useful therapeutic targets for overlap patients. So the stressor of exercise greatly impacts not only heart functions but also cerebral blood flow and oxygenation in COPD patients during exercise.